Welcome everyone. Presentation today is on veterinary forensics, and my name is Dr. Becky Morrow. And I thought I'd introduce myself a little bit. Here's a picture of me holding my little cat in a coat, which she doesn't look super happy in the picture, but you can believe me that she gets cold and she likes to have her coat on when we go out in the winter. Anyway, my background is in biological sciences and veterinary medicine, although now I am finishing up a master's in veterinary forensics and the related field of shelter medicine, which involves animals that are in shelters, as well as the different associated fields related to that, including forensics, because we deal with a lot of cruelty cases associated with those animals. So I've been practicing for over 22 years as a vet. I've also been a professor for 15 years teaching physiology, molecular biology, and so forth. And have over 10 years rather in shelter medicine and forensics experience. So, what is veterinary forensics? Well, it's actually very similar to forensics of any other sort, where you apply a broad spectrum of sciences to answer questions of interest to a court of law. And that's where the forensic aspect comes into. It has to be associated with the law. So forensic veterinarians play a role in this process because this is a veterinarian who has experience and training as well as the knowledge to apply the veterinary medicine that they are skilled in to answer questions of interest to the law. So you have to know the law, obviously, be familiar with local, state, and federal laws, and also know the normal standards of care for animals, which if they are breached, of course, that would create poor welfare situation for the animal, and also be able to understand pain and suffering, because that's going to be very important to convey in court if you're dealing with a cruelty case. So knowing both forensic science and medicine is important, and having experience with cases of animal abuse. And that's, of course, something that you gain as you learn, but hopefully at that point you have others that will give guidance to you, and you can use the scientific literature, and there are some books on the topic. I actually went to a workshop on forensic science, veterinary forensics, when I was preparing for the biggest case so far I've had in my career. I was very, very early on in learning whenever that hit me, but I think we did pretty well. We did get the relinquishment of several hundred animals to our care, and kept the woman who had abused via neglect, basically, a passive abuse, we'll call it, thousands of animals each year, and let them die at the facility. So very important. A lot of things are on the line here. Suffering of these poor animals that you can deal with and stop these things with your knowledge and ability to convey that knowledge to a court of law. So yeah, testifying, making reports, that's very important. I wrote 455 reports, one for each animal I examined, and dealt with and took care of for over a year and a half, the ones that lived. And that was a big determining factor, I believe, in the defendant finally pleading guilty to charges that, again, led us to be able to save those animals and keep her from having animals for the rest of her life. So very important to be able to do that. And you have to be able to talk to jury members and the judge and all of these people that don't have veterinary knowledge or forensic knowledge in some cases, as like juries. You have to be a teacher to them, convey what has happened, and also to allow them to understand. So for instance, one of the things that I often come across are pretty severe skin conditions and hoarding cases where the cat or dog will have missing fur, they'll have scabs all over their body, evidence of chronic itchiness. And I try to, bring into, well, if you've had your body covered with mosquito bites and they're just constantly covered with mosquito bites, how would you feel? So allowing the jurors and perhaps the judge, if it's a non-jury situation, understand is very, very important to the outcome of your case. So you really do have to have all of these problem-solving skills that we use as scientists to put together the pieces of the puzzle and really advocate for the animals. What we also can do with veterinary forensic science is establish if a crime has or has not been committed. Of course, in this case, it's involving an animal, and then also help to solve the animal-related crime. What we want to consider is even if people are not concerned with the welfare of animals, which is bizarre to me, you have a direct link between human violence and animal cruelty. There's overlap here. And oftentimes, crimes against animals can be a warning sign of crimes against humans. So this is really going to impact everyone in society as a whole. Animal abuse also can occur with other crimes. So think of dog fighting. There's probably some drugs, weapons, other charges that might be associated with animal cruelty as well. So what do we do as forensic veterinarians? Well, investigate crime scenes, which is something that you probably would think of for forensic scientists in general. Performing forensic examinations of live victims, so doing a very thorough physical exam, including collecting trace evidence and documenting everything very thoroughly. Performing forensic examination of deceased animals, and we call that necropsies. Autopsies, auto means self, so this would be anything but human. We call it a necropsy. You can also say post-mortem examination, or PM. And then, of course, providing the expert witness testimony and reports that I just mentioned. So what is the difference here in human versus animal crime scenes? Well, there are not too many people that can do this in the veterinary field. Unfortunately, resources are very scarce, and we don't have supporting specialists, whereas in human crime scenes, there's going to be multiple professionals involved. Think about the TV shows you may have watched and how many people are at those scenes. In human cases, one or a few victims usually, versus animal cases, you can have 1 to up to hundreds of victims, as I mentioned in the case that I was involved in. So the other thing we don't have are forensic laboratories that are devoted to animals. We have to send our samples to veterinary schools or private laboratories. I sent bones to a laboratory in Michigan, I believe, for a fat analysis, which was associated with a starvation of animals when they have very low marrow fat. There's actually a percentage. You can get a quantitative result, a number to use in court, which is very helpful. Sent some samples to UC Davis for what was that one? There were different genetic tests and so forth I ran, and I think tests for pathogens there. And then, of course, in animal crime scenes, we're dealing with multiple species, whereas in human crime scenes, it's just humans. So what do? Our CSI, crime scene investigation. Important to triage live victims. We want to establish which animals need attention first, what need veterinary attention care. Unfortunately, you can't just grab them out of there and start giving them care. You have to document everything very carefully. You have to allow the law enforcement personnel to go to the scene to make sure it's safe for everyone, the veterinary personnel to come on, make sure that the scene is not disrupted so that we don't have evidence thrown out because of improper protocols. There's a lot of things that need to be done properly, of course. What else can we do, though, as veterinarians that are trained in forensics? We can also help law enforcement know what's of use for their case. They may not know a certain drug is associated with dog fighting and what people use to enhance the muscles in those dogs, and perhaps things that treat wounds. They wouldn't know what it was. Proper preservation of evidence, that's important too, for biological evidence, as well as for these different things at the scene that you may find. They could be some things you would put in the freezer at -20 degrees Celsius, other things you might put in dry storage. That's something that we would be able to assist with. And then also assess the scene and its effects on the victims. So what does that mean? Well, if you go in and you can't breathe because the ammonia level is so high from the excrement in the house that has 50 cats, then you can describe that to the jury. You can describe that to the judge, and that's going to be more compelling than if you were just told what the scene was like by others that were there. So you become not only a fact witness, but an expert witness, and you can comment and draw conclusions on what you experienced, not just present them as facts. So that's very powerful. So here's the case I was mentioning, Tiger Ranch case, where we had over 6,000 cats a year that went into the facility and did not come out. So we suspect that that's how many died. This is a picture that we took at the time. This was how we saw the scene. These cats are obviously in severe need of veterinary care. They're not even moving, even though there's law enforcement everywhere on site. We had to document this first, and then those were the animals that we pulled first to give them care. And unfortunately, none of these cats made it. They were just too far gone. But you can see we designated this room, which I use the term loosely. It's a small area in the garage that she put plywood up and put the cats to die. This is room B. We called it the death room, but we didn't use that in court. And then this is another room that was showing the cats that were being housed and the conditions. This was building J. We designated it. There were over 120 cats in this facility, and they also could go out to an enclosure, but they were all together in this room plus the outside enclosure. And then this was the 20-foot by 12-foot across, and I think it was 12 feet or more deep. You can kind of tell by the person. I'd have to look that up. The pits that she would have dug to throw the hundreds of animals. We estimated 500 animals every 2 months. She would have the bulldozer person come and put the animals in there. And all of these crime scene markers here were designating bones that were found at the scene. And unfortunately, this was a deceased cat that was behind the freezer. We found 106 cats in the freezer, deceased, and then this cat dead behind the freezer at the time of our of the rescue / raid, we'll call it. And then again, just pictures of the facility and the conditions, and you can just see how this excrement is all over the walls. It's all over the floors. This is not clean in the least. This is not appropriate environment for the animals. That was probably the least of their worries. They were exposed to infectious diseases that were very, very well, fatal, of course, but produced a lot of suffering and slow, tortuous deaths that we had to prove in court. So that's our investigation of crime scenes, some examples. If I wasn't there, it would be really hard to be a good witness in court. And also, again, the law enforcement wouldn't know which animals to pull out first. They don't have the expertise to remove those animals to provide emergency veterinary care. We were right on site. We were able to do that, euthanize the animals that were beyond saving and stop the suffering and treat the ones that we pulled out. We were able to do that right there on the spot. So the next section here I mentioned is performing examinations of living deceased victims. So these were the cats as we pulled them out. You could see that we gave them each a unique number based on the room they were removed from, and we just did a sequential numbering. So this cat was removed from what I called the death room. B is what we designated that room, and this was the third cat we removed. And then we did some examinations. I had to document everything very thoroughly to show them in court because, again, the people in court were not there. We have to show them what we saw and make our case be compelling that they could stop this from happening. And this poor cat had multiple infections, as you can tell probably from the discharge from the eye. This was necrotizing fasciitis, flesh-eating diseases we found. And I had to document all of this very thoroughly, as you can imagine. These were not the forms that I used at that time, but this is the form that I use now that I created to have a consistent record of our findings and also a record that was easy to follow so you didn't miss anything. So we have this kind of like a checklist in a way so that we make sure we gather all the evidence that we need and also formulate a plan that you can see. We have treatment, vaccines, the plan, all of that written on there as well. And then I sign them after that is finished. Along with that, we do photo documentation, and then we produce reports. So this was an example of B3, the report of the cat that I just showed you there. This cat was found in, and we called it the isolation room instead of the death room because we didn't want to be inflammatory for the court. But this cat was emaciated, severe muscle wasting, severe dehydration, pale gums, couldn't even hold her head up. She was so weak. Large amount of eye discharge, nasal discharge, ulcerated tongue, bleeding ulcers on her mouth, painful belly, matted fur, fleas. We had to put this poor kitty to sleep. And then I put all my diagnoses there as well as, whoops, apologize for that, slipped ahead. This is another case which was more recent, and you can probably tell on the limb that there's something wrong here. It looks about 4 times the size of the other limb, and this was a ligature. Someone actually wrapped around a rubber band, wrapped that around this cat's limb, didn't notice it, supposedly brought the cat in for treatment. It's pretty obvious that that was what happened, and it was intentional because it was wrapped multiple times around the limb. This little cat, I got good pictures showing the cat was under anesthesia, so this was not causing her any pain. There's the rubber band right there. It was clearly visible. What else would I document? The smell was very bad because this is some tissue that's been cut off from its blood supply. As you can imagine, there's swelling. There's also, you're prohibiting the blood from getting down there with oxygen and nutrients and removing waste. This little cat ended up doing okay. I'm going to show you some pictures of that. But I still, like I said, before I started treating the cat, had to make sure to document everything. So here's another picture of the rubber band wrapped around twice. You can see that's exactly how I pulled it off. And pictures of the limb after I removed it. So as we were doing our exam, we made sure to document that very clearly. What else do you want to document? Notice this is actually looking better. This is sequential improvement. And what you need to show in court is not only that this could have been prevented, but oh, this cat's going to get better just based on simple care. So there's no excuse these people had for leaving the cat in that state. So we can see she starts to walk on it. She's very cute. She still has some goo on her chest because she's laying on the leg, which is still pretty, it's discharging still because of the dead tissue. And she ends up getting better and better. And that's almost better 100%. And she ends up going to a new home. We got custody of her. This is a situation where this is a deceased patient that came in. This dog was brought into us frozen. It was found frozen outside, and the law enforcement, their question was, did this dog freeze to death? So we are answering that question, we're hoping to, when we examine this dog. So when we got the dog, we did an external examination first. We were looking at basically doing a physical exam before you open the body, and also looking for any trace evidence, anything that might be related to a crime or anything that might be pertinent. So we kept the dog's collar, we kept that in evidence, locked up, and we really didn't find anything else on this dog that was pertinent evidentiary purpose, just from the examination. And we looked at the teeth, the mouth. We looked at, there's our collar that we took off. You can see there's some mud on it, so that could have shown some signs of neglect perhaps. So we saved that and documented. That's me and my former student, Diana, doing this examination. And we were documenting that there's some blood that we found when we started to dissect down into the abdominal and chest cavity. You can start blood there. As we opened the abdominal cavity, we could see blood. And lo and behold, there's blood all through the abdominal cavity. So then we're trying to figure out, what is the source of this blood? Is this a significant amount of blood? Where did it come from? Was there cruelty involved? Essentially, you know, all of these questions that we just talked about. So as we further examined the dog, we found that the liver was full of these little hemorrhages, and it seemed to be associated with some pathology of the liver. There was no evidence from the external examination of any sharp force trauma. So no, not like stabbing or something like that. And there was really no evidence of bruising when you reflected the skin back, and when you looked on the inside of the body wall, there was no evidence of bruising, which you would see if there was kicking to the abdomen or something like that, which would indicate blunt force trauma. We had no indication of that. So at this point, it appeared to be the liver hemorrhaging due to a disease process that caused the dog's death. So we took out the organs, we documented that. This is the spleen that is very, very small. Actually, it should be much wider and plump in appearance, and that's significant because when you have a hemorrhage, the spleen acts as a reservoir of blood cells, and it's basically like a sponge in a way. It squeezes out, and the blood cells then go into circulation to try to help compensate for the blood loss. So this is consistent with the hemorrhage that we found and the body's response to it. So I wrote a report as we discussed where the dog was found and what condition we found the dog in, as well as the opinion that in this case, the cause of death was internal hemorrhage and led to circulatory system collapse. This did not, the dog did not die of, did not freeze to death per se. Certainly the cold temperatures when you're hemorrhaging, that could be secondarily affecting the animal, but that was not the main cause of death. Although we did find signs of neglect because of the mud on the collar, the nails were very overgrown, and there was discharge from the eye. The dog was undernourished, and we still had some evidence of neglect. So, last thing here on my list, providing expert witness testimony and reports. Yeah, I mean, expert witness testimony is very important because as I mentioned earlier, you as an expert witness can make sense of some of the facts and help the jury to understand what these things may mean. For instance, if I walked into, let's say a police officer walked into a house and noticed that on the white couch there were a whole bunch of little black specks, and then if you wetted it turned into a deep red color. They wouldn't know that's flea droppings. These are the things that they would not be allowed to say it was flea droppings, even if they did know that, because they're not an expert in veterinary medicine and parasitology and so forth as we are. So if you're a fact witness, you're only allowed to say what you saw and not interpret what you saw. An expert witness can interpret what was seen either by themselves or by others that were at the crime scene or saw the victims. So we have to also not oversell it. I mean, you might know some things, but there are other things that you don't know. Some of the pieces of the puzzle aren't known, and you have to be sure that you're not testifying to something that you do not know. So it's very important as far as credibility, and of course you're under oath. You have to be careful to only make conclusions, draw conclusions that can be drawn and not overstate your opinion. So in some cases too, there are actually deficits in our knowledge and scientific research in certain areas, and you can only draw conclusions on what the evidence shows. One example that I came across was in the Tiger Ranch case. There were 106 frozen deceased cats, and the defense was trying to say that I could not tell anything from a post-mortem exam in a deceased animal that was frozen. Well, obviously, that's not the case because the dog was frozen that I just showed you. But one thing I wasn't sure of was how much freezing affected the tissues. There wasn't a lot of research on that. So I did a study, not a published study, but a study to help me to determine, interpret the findings for court. I did a controlled study where I had deceased cats that I took some of the organs from the same cat, if they were matched paired organs and so forth, put them in the freezer, and put some of them just in the refrigeration, and it was a blind study, so I was looking at both sets of organs and basically found that the organs change in consistency and a deeper coloration, but you can still see the lesions or lack of lesions either way, frozen or unfrozen. So that was useful for court. So overall, this is a really broad field that you have to pull in a lot of different sciences. You might be looking at bullet trajectories, or you might be looking at blood spatter patterns or DNA evidence, doing necropsies, doing an evaluation of agricultural animal welfare at a scene. So there's a lot of different fields that you have to be aware of, and in some cases you may need to pull someone else in that has more experience in a particular area than you. Again, this is an important field, and hopefully we get more support in this field from society and resources for this, because it's really important to look at animal crimes for the horror that they already are, but also for the connection that they have with crimes against children, domestic violence, and other things as well. So we saw that the veterinarian's very involved in all these aspects of crime scene investigation, examination of victims, both living and deceased, and preparing for court, helping the prosecution or perhaps the defense, depending on where you are, prepare for court, and then giving expert witness testimony. And really, I mean, as veterinarians, that's our job, to advocate for animals in society and to be able to speak out against abuse of these animals. They don't have their own voice to speak out. We have to be their voice. And, in medicine in general, when you look at human medicine, which we call it, which dealing with all children, adults, and so forth, there's a duty to protect the innocent, those that are victims. And we have that same duty in veterinary medicine. So we also need to protect these animals and report abuse, and also be there and use our expertise and our experience and knowledge to help these animals in court. So if anybody has any questions about this or is interested in veterinary forensics, I can be reached at my nonprofit organization, Frankie's Friends Cat Rescue. We have a website here, www.frankies-friends.org, and we're also very active on Facebook. on the website, there's a email function, so you can always email me, or you can Facebook message us. All right. Well, if you have any questions on that, please feel free to reach out. Any comments, anything else, interest in the field, let me know. And I'm sorry I couldn't be there in person with you, but happy to be able to present this really interesting and I don't know, I guess it's a fairly new field in veterinary medicine and forensics for that matter. All right. Thank you guys so much. Hope you have a great day. Take care.